Hello, my name is Helen Camish. I am the General Manager with Humber Teaching NHS Foundation Trust. I'm responsible for all the community services and primary care services with Humber and the responsibility for Whitby Hospital. So over 6 years ago now, Hamilton, Richmondshire and Whitby Clinical Commissioning Group gave us the green light to be able to refurbish the building here on site. Building work started here on the 23rd of March 2020, where we moved out of the existing tower block into new temporary accommodation at the front of the hospital, and we gave over the tower block to BAM, the construction site, to start the work. It's been a long and bumpy road through a global pandemic to get us to this point today, but we are thrilled and privileged to be able to open this facility for the local residents of Whitby. This is the ground floor, which predominantly delivers podiatry and dentistry. These are services delivered by Harrogate and District Foundation Trust. Dentistry is a specialist service that provides dental treatment for children and adults who, because of additional needs such as learning disabilities or physical disabilities or vulnerability, are unable to access general dental care. Podiatry is a clinical speciality that deals with the assessment, diagnosis and treatment of foot and lower limb conditions, including things like nail surgery, the management of high-risk feet and biomechanics imbalances. There is also a cafe run by NHS Property Services. It will be open for staff, visitors and the public, 8:30 till 2:30, with a vending machine facility available 24/7.
My name's Ian Peach. I'm an advanced clinical practitioner at Whitby Urgent Treatment Centre, and I'm excited to introduce our new urgent treatment centre on the first floor of Whitby Hospital. The main area of our first floor is our urgent treatment centre, which is not only in a shiny new building but is a brand new service for our hospital, as it was formerly a minor injuries unit before 1st of August 2021. This change in service delivery means that we can now offer support not only for minor injuries but minor illnesses, so people can come to us with things like a fever as well as suspected broken bones. The new urgent treatment centre ensures that local patients have improved access to urgent care regardless of where they live. It's a fantastic investment in our local communities.
I'm Kelly Scott. I'm an urgent care practitioner. I've worked at Whitby Hospital for the last 20 years and we're really excited about moving into our new urgent treatment centre. The Urgent Treatment Centre is available 8 AM to 8 PM 7 days a week, and what is brilliant about this new service is that it is integrated with NHS 111, so patients can call and check that it's the right place for their needs and to book an appointment before heading towards the hospital. This level also includes new X-ray and ultrasound facilities. This is state-of-the-art, innovative equipment that enhances our services and is fit for purpose for years to come. The beauty of the Urgent Treatment Centre and X-ray facilities being on the same floor, in the same building, is that they can work efficiently, side by side, reducing travel time across the site for both staff and patients. The first floor also contains the outpatient services where a range of clinics are delivered. For example, ENT clinic, pain services, children's therapy. It is also home to our GP out-of-hours service, which is operational in the evenings and on weekends and bank holidays. It also offers a place for sexual health services and midwifery services run by York and Scarborough Teaching Hospitals NHS Foundation Trust to be carried out.
Hi, I'm Louise Lockley, Clinical Lead Physiotherapist for the community team at Whitby Hospital. This is the second floor where our physiotherapy services reside. There are treatment areas for individual assessment and treatments for those patients with musculoskeletal problems, and also gym facilities for ongoing rehabilitation available for MSK, community service outpatients and inpatients. Access to the gym space for our inpatients will help with their rehabilitation and independence. The gym area may also be used to run pulmonary and cardiac rehabilitation clinics. Outpatient occupational therapy clinics for chronic long-term condition upper limb management will also run from this area. This floor is also home to the new audiology booth, which will be delivered by York and Scarborough Teaching Hospitals NHS Foundation Trust and is purpose-built with innovative technologies which bring the hospital into the modern age. This is a wonderful investment for the local population and we're extremely grateful to have this here at our community hospital. Tees, Esk and Wear Valley's NHS Foundation Trust deliver their mental health services from this floor also, including their IAPT offering, and we are pleased to say that our Wobble Room has made it into the new building on the second floor. Our Wobble Room is a place for staff to come for a short break when they're feeling overwhelmed at work. It was introduced in the first wave of the pandemic as part of our increased staff wellbeing policies. This floor also includes an office for our 0 to 19 service delivered by Harrogate and District NHS Foundation Trust, the Occupational Therapy Kitchen and the Allied Health Professionals Therapy Room. This is our flexible working space for our integrated multidisciplinary community services, including our administration, community nursing, community therapy and speciality community teams. We call this our touchdown area, and the purpose of this is to aid collaborative working between our teams in a modern and comfortable new space.
Hi, I'm Cathy Davis. I'm the charge nurse on Whitby Hospital Inpatient Ward and I'm proud to present you the new Memorial Ward. Here we have the new 16-bedded inpatient ward. 9 of these beds are single ensuite rooms and we have a further 3-bedded bay which is also ensuite and 2 2-bedded bays which are also ensuite. All rooms on the ward are now more spacious to help aid a comfortable stay for the patients. The colour scheme and furniture on the ward have been developed to be dementia friendly. Our bedrooms are fully equipped and are fit for purpose to meet the clinical needs of anyone who needs to stay on the ward. This floor also has the Heather Room, which is a quiet space just off the ward where families who have loved ones on the ward can spend time in privacy and comfort.
We have tried to ensure the external environment complements the hospital. The garden is designed as a dementia-friendly space with focus on the senses, with wide paths to accommodate everyone. We're currently working with the community to ensure this is designed and completed with lots of their perspectives in mind. The car park has proper spaces, room for both staff and patients. We've incorporated electric charging points for those who have hybrid or electric cars. There is external pedestrian links into the town, an ambulance bay for patients arriving at the urgent treatment centre or a drop-off facility for patients at the ground floor level. This modern and fit-for-purpose facility will allow us to bridge the gap between care at home and specialist hospital care. The building will allow us to work more collaborative with our system partners who will be here to deliver a range of services, and we'll work within a multidisciplinary approach. I'd like to take this opportunity to say a great big thank you to our Health Stars team and to everyone who has contributed to the hospital appeal. Thank you for those that have donated so far and for your generosity that is going to add that extra sparkle to our hospital.